If you're unconscious, unable to speak, and heading toward an ambulance with a paramedic, just like this guy right here, there's a 90% chance that these paramedics have no access to your medical history. This leads to crazy events like delays and mistreatments and potentially death. We have a broken system that costs lives. 30% of EMS involve patients that are unable to communicate. This is also a broken system that costs billions of dollars. Hospitals and EMS pay this amount daily in reimbursements. They also pay this amount in missed information, documentation, and especially a lack of inefficiencies within the ER. 80% of ER errors are due to incomplete documentation from the patient, and EMS is very hesitant to make these decisions because of this lack of patient information. For instance, if a paramedic sees you and you have an issue, a paramedic may not treat you with a life-saving solution because they're afraid that they may make the wrong decision because they don't know that you have a history of diabetes per se. This happens so often that this measure is truly ridiculous at 80%. A paramedic will also be hesitant to treat you because they will not be able to justify it in their billing. This creates a reimbursable software that we have with eLife. We created the first emergency healthcare data network. eLife takes medical information and shares it directly with medical professionals immediately and instantly at the point of contact. How do we do this? We connect health information exchanges to a patient-centered tool. We take that data and we store it on wristbands and cards, like you can see here. That data can then be transferred at the tap directly to a paramedic. It goes directly into a paramedic system, and then it goes to the hospital so they can treat you before you get there. Here's how it works. The EMS scans eLife. The eCPR system, which is basically a paramedic's charting system, takes that information. It helps with their reimbursed claims. Goes back into eLife and then gets shared into the ER system, whatever ER they're going to, and it helps with their reimbursed claims. This is a reimbursable system. This is a system that pays for itself. This is a system that will change many, many lives because of how big the problem is. You know, it's a $500 billion market. This problem is not only life-threatening, but it's costing hospitals billions of dollars every year, hospitals and EMS. If a paramedic comes and treats somebody and they're unable to justify to EMS why they're treating them, they do not get any reimbursement for that. And this is just lost revenue. So although eLife is solving a huge problem, eLife is solving a huge financial gap in this industry by filling in all of these gaps in pre-hospital care. Let's see. How are we going to do that? We're going to start with critical mass adoption through DDS partnerships. These are partnerships that we have already gotten in Georgia. We've already been approved to market on every DMV and every kiosk in the state. So we'll put the eLife summary on the back of each one of your licenses. If you have a Georgia license, a paramedic will then be able to find your eLife summary through that license, query that information, and assess you quicker, more efficiently, potentially saving your life. It'll also go into the EPCR system, which is a paramedic's charting system, not your EHR, and then that will help them with the billing. An EPCR system a paramedic's charting system will pay for this and license this information because they are already in control over the billing. They're already in control over how much the EMS gets reimbursed. So they'll pay for the licensing of the product. We'll also license it to license the data, the pre-hospital data, to the hospitals. Like I said here, eLife isn't an added cost, it's a reimbursable service. When people have this pre-hospital information immediately, they're able to do way more with it, and they're able to also save a lot of money that they're already losing. So we're scaling eLife to a $50 million healthcare opportunity in 5 years. The market is just out of this world, the problem is out of this world, and the way that we'll do it, the way that we'll solve this critical mass by going on every driver's license, damn, bro.